Should you have an immediate or delayed flap reconstruction? Common question, lots of questions sent to me in DMs. Sometimes it's not up to you. I don't offer immediate flaps because I just can't from a scheduling perspective. I can't get patients in as quick as they need. My next available flap day is like 9 months from now. So sometimes it's not always an option, but if it is an option, things to consider. If you have an immediate flap done the same day as your mastectomy, it's going to be a harder recovery. It's going to be more pain because you're cutting all of those nerves in the chest and the belly for the first time. Studies show that people need more narcotics, more pain. Makes sense, right? You're cutting all those nerves for the first time. Versus a delayed approach, meaning a separate day from the mastectomy, when most of those nerves in the chest have already been cut. The other benefit of doing an immediate approach is you're done. You have one really long day, but then apart from upper revision surgery, you got your breast reconstruction. The con is if you need radiation, then you're radiating that beautiful new belly tissue or thigh tissue that you just brought up to make a breast. Studies do show that radiating a flap versus a tissue expander and then a flap has less wound healing complications, but it can have more fat necrosis because then you're radiating that beautiful belly tissue. So there's definitely pros and cons to both. I think that it's worthy discussing with your surgeon if they offer it, what they think the pros and cons are. Is it an option from a scheduling perspective? The other thing with tissue expanders and then a flap is that some patients choose to have implants. I've put some tissue expanders in people planning for a delayed flap, and then over the course of time, they decide that they don't want another big surgery. They just want to have implants. So tissue expanders keep options open. This is a really hard conversation, and this is why breast reconstruction consults take so long, and they should take time to discuss all your options. Let me know what questions you have below.